Hello everyone, welcome to today's video. In this video, we'll be diving into a common yet often misunderstood condition called frozen shoulder, also known as adhesive capsulitis. If you or someone you know has been dealing with shoulder pain, stiffness, or limited mobility, this information could be very helpful. Frozen shoulder can affect daily activities, sleep, and overall quality of life, and it often takes a while to fully recover. Today we'll explore what frozen shoulder is, what causes it, who is most at risk, the stages of the condition, and how it's treated. Let's jump right in. Frozen shoulder, medically known as adhesive capsulitis, is a condition that leads to stiffness, pain, and limited range of motion in the shoulder joint. Unlike some injuries that may improve in a matter of weeks, a frozen shoulder can take much longer to resolve. It often develops gradually, worsens over time, and may take up to 3 years for full recovery. The condition happens when the connective tissue surrounding the shoulder joint, known as the capsule, thickens and tightens. This tightening restricts movement in the shoulder, making even basic actions like lifting your arm incredibly painful and challenging. Let's talk about who is most likely to develop a frozen shoulder. Generally, people over the age of 40, especially women, are at higher risk. One key risk factor is immobility or restricted movement in the shoulder. This can happen after surgery, an injury, or a period of prolonged inactivity. For example, if someone breaks an arm or has shoulder surgery, they might need to keep the shoulder relatively still during the recovery period. This restricted movement can increase the risk of frozen shoulder developing. In addition to age and immobility, certain medical conditions also raise the risk. People with diabetes are especially prone to developing frozen shoulders, though the exact reason isn't entirely clear. Other systemic diseases such as thyroid disorders, both overactive and underactive, cardiovascular disease, and Parkinson's disease, have also been linked to a higher likelihood of experiencing this condition. Now, you might wonder why the shoulder joint tightens up like this. Unfortunately, the exact cause isn't entirely understood. However, one clear thing is the role of immobility. The shoulder joint is surrounded by a capsule of connective tissue, and when this capsule thickens and tightens, it limits the joint's range of motion. In most cases, frozen shoulder occurs after keeping the shoulder still for an extended period, as with recovery from surgery or an arm injury. The reduced movement can lead to inflammation, thickening of the tissue, and eventual stiffness in the shoulder joint. Although the precise cause remains unknown, some theories suggest that the body's natural response to injury or surgery might contribute to the formation of adhesions, which are bands of stiff tissue. These adhesions restrict movement, making the shoulder feel frozen. The symptoms of frozen shoulder develop in 3 stages, and understanding these stages can help you manage expectations if you're experiencing or recovering from this condition. In the first stage, known as the freezing stage, the shoulder becomes increasingly painful and movement gradually becomes more restricted. Any attempt to move the shoulder often causes significant pain. This stage can last anywhere from 2 to 9 months. During this period, people tend to avoid moving their shoulder to minimize pain, which unfortunately leads to more stiffness. Next, we have the frozen stage. During this stage, the pain may decrease slightly, but stiffness becomes more pronounced. The shoulder's range of motion is severely limited, making it challenging to perform everyday tasks, like reaching overhead or even putting on a jacket. This stage usually lasts from 4 to 12 months. It's often frustrating because the pain may have lessened, but the lack of mobility persists, making it difficult to resume regular activities. Finally, in the thawing stage, the shoulder gradually starts to regain its movement. The pain continues to diminish, and you'll notice an improvement in range of motion. This stage can be the longest, lasting from 5 to 24 months, but it brings the welcome relief of gradual recovery. One point to note is that for some people, the pain may worsen at night, making it difficult to sleep. This can lead to additional challenges such as fatigue and frustration from lack of sleep, which can impact daily life. If you're experiencing symptoms of frozen shoulder, it's important to consult with a healthcare provider. The diagnosis is often made based on medical history and a physical exam. During the examination, your doctor may ask you to perform certain movements to evaluate your range of motion. In some cases, imaging tests like an X-ray or MRI might be ordered to rule out other shoulder conditions, such as a rotator cuff tear or arthritis. Treating frozen shoulder involves managing pain, restoring range of motion, and addressing the underlying stiffness. The main goal is to reduce pain and gradually improve the shoulder's ability to move. Here are some common treatment methods. Range of motion exercises. Gentle stretching and exercises aimed at improving flexibility are the cornerstone of treatment. Physical therapy may be recommended to guide you through these exercises, helping to ensure that you're performing them safely and effectively. It's essential to start slow and be patient, as aggressive movements can aggravate the condition. Medication, over-the-counter pain relievers like ibuprofen or acetaminophen, can be helpful for managing discomfort. In some cases, a doctor might recommend corticosteroid injections, which can reduce inflammation and provide temporary relief from pain. Hydrodilatation. This procedure involves injecting a large volume of sterile fluid into the shoulder joint capsule to help stretch the tissue. It can be effective for some people and may speed up recovery. Arthroscopic surgery. While surgery is rarely needed, it's an option for severe cases that don't respond to other treatments. During an arthroscopic procedure, the surgeon uses small tools to cut through adhesions and scar tissue within the joint, allowing the shoulder to move more freely. Physical therapy and exercises remain the most commonly recommended treatments. Working with a physical therapist can help you regain motion slowly and reduce the risk of further injury. Remember, patience is key with frozen shoulder recovery. It can be a long journey, but with consistent effort, you can regain mobility. Now that we know about frozen shoulder, let's discuss prevention. If you've experienced an injury or surgery that limits shoulder movement, be proactive in keeping your shoulder active. Speak with your healthcare provider or physical therapist about safe exercises that can maintain range of motion. Even gentle stretches can make a big difference in preventing stiffness from setting in. It's especially important for individuals with certain health conditions, like diabetes, to be aware of this risk and take preventive steps. Regular exercise, shoulder stretches, and keeping the shoulder as mobile as possible can be extremely beneficial. Thank you for watching this video. I hope you found this information helpful. Don't forget to like and subscribe if you want to see more health and wellness content. Take care of yourself, stay active, and I'll see you in the next video.